experiences that we've had on the motorcycle have just been fabulous. You know, just seeing things that we never knew Iowa offered. We had rented a motorcycle for me to ride, so the next day we were going to return it. It was a beautiful day. I mean, absolutely beautiful. And no wind, no nothing, and it was just gorgeous. A straight line wind came and hit me and just scooped me right off the motorcycle. Fortunately, I think my lucky stars, there was a Midwest Ambulance Service, I think that was the name of it. They were going by at that time, and they called the helicopter right away and got everybody there really fast. And I think that's why I'm here.
Broken. She was broken. At that time, her hand was actually had a rod and several pins in it.
My injuries consisted of my right ankle fractured with an open fracture, my left tibia, the tibia plateau. I had a crushed thumb, left thumb. I dislocated my shoulder, and needless to say, I injured those nerves. I was bedridden for about 6 months. I couldn't put any sort of weight on my legs whatsoever.
So we worked a lot on just trying to get her in and out of bed, trying to get her from the bed to the wheelchair. Some days when I would come to see her, we would spend a lot of time just talking about the obstacles that she was going to be, you know, running into.
I met Deb on her birthday, February 9th. She's just blew in here and, you know, just took over. Sherry, also known as my vampire, she came in once a week and took my blood.
She was on blood thinners, so we had to make sure that those labs were within normal limits. If not, we would adjust the medication. So there was a lot of communication with her primary doctor in regards to that.
What they did for Carrie a lot of times was more than being a PT or being a nurse.
I contact nursing if I see problems with the blood pressure.
If there was a problem, I'd send it to Deb. Hey, she seems a little down. She says she's not doing the exercises. She's having more pain. So then Deb was aware before she came in.
Care coordination to me is seamless transitions. The patients shouldn't know. The patients shouldn't feel the bumps, because Carrie had enough going on at the time she left the hospital that there didn't need to be any other, I guess, outside interference that came in.
Our goal was to keep her at home. So anything I could do to make sure we didn't go back to the hospital, that's what we were doing.
Carrie was very motivated, and that she would accept the challenges that I gave her.
They treated me like I was their only patient, and that they were there to attend to everything that I needed. They became part of my family. You know, they helped me. They were here in some of my lowest points. That support that I got from them made all of the difference in the world.
To take Carrie from where she started to where she is now as I see her today, that in itself is amazing.
Carrie has made a great recovery. I mean, she has done spectacular in everything she's done.
She's walking. She's back to normal. She's back to Carrie.
You don't appreciate what's right in front of you. And sometimes in the blink of an eye, it's gone, and your whole life changes. And I was always a very grateful person, but I'm even more so grateful now to all of the people that took time out of their lives to help me.